Welcome.
Good morning. This is David Baum. I will be your host today, and as your screen should show, this meeting will be recorded. We ask that everyone mute themselves and stay muted until we get to the questions and answer session. We also suggest that you turn off your video for the simple reason that it consumes resources on your computer and ensures that your resources will be available so that you can see the slides without any potential for any interference. This morning's presentation is entitled Leave Nothing to Chance, Preparing for Your Hospital Visit. Parkinson Social Network is an all-volunteer 501c3 nonprofit organization. All of the members of our board have a personal connection to Parkinson's disease, and the board are the volunteers who make everything happen. PSN's mission is to support, advocate, educate, and enrich the lives of those touched by Parkinson's disease. We are here to help you. Our website is shown, our email address is shown, and our telephone number is shown. The telephone is normally answered during business hours. If for some reason we are away, please feel free to leave a message as detailed as possible, and someone will call you back. Please remember to stay muted at all times. You're welcome to put comments or questions in the chat. We will address that at the end of the presentation during the questions and answer period. During that time, we will also ask people to raise their hands if they have questions that they were unable to enter into the chat. We do wish to acknowledge that some questions were in fact submitted at the time of registration. We will attempt to address them in the presentation. If you have a question that you submitted previously that has not been addressed in the presentation, then please raise it again during the question and answer period. I don't need to tell you about my background. This slide shows you my qualifications as they relate to this particular presentation. Just know that I have been a patient advocate for the last 20 years in various hospital settings, and I continue to do that. The goal of today's presentation is basically to provide you with the information and guidance that you need to be helpful in preparing for your next hospital visit. By hospital visit, I mean either an emergency visit that you didn't plan, or a planned visit for an outpatient procedure, or a planned visit for an inpatient stay, whether it's medical or surgical. People with Parkinson's disease have special requirements that are unique to their role in having that disease or to the medication and nutrition management requirements for being a person with Parkinson's disease. And like any other patient, you have to advocate for yourself or have an advocate with you when you're admitted. One of the ways in which you can advocate for yourself is to prepare in advance for a potential visit to the hospital, and that's what you will hopefully be able to do after this presentation. You start preparing now. Don't wait until you have a scheduled visit. Emergencies happen randomly, and if you're prepared in advance of an emergency, you'll be much better off when you're picked up by the ambulance, when you arrive at the emergency department, and when you're admitted to the floor. What to do for advanced preparation is the first section of this presentation. One of the things are the items that we will explain in detail that you have to prepare in advance are to obtain a medical device or identification document, to obtain a letter from your Parkinson's disease physician, to prepare a detailed medical history document, to prepare a listing of any implanted medical devices, to prepare a listing of the medications and supplements that you are taking, and when those medications are taken and to prepare the critical documents. Now, critical documents is a term that we defined in our previous presentation on what documents everybody should have and why. That is available on the PSN YouTube channel in case you weren't able to attend the previous presentation. It is also available in PDF form if you send an email to info@parkinsonsocialnetwork.org and request the PDF for that presentation. I should also point out today's presentation will also be on our YouTube channel, and we will automatically send the PDF copy of the presentation enhanced with hyperlinks for the documents in our reference section to all those who are registered for today's presentation. A medical device or identification document. What we're referring to here is that you either wear a bracelet, a necklace that identifies you as having Parkinson's disease or having certain medical issues that have to be addressed by an EMT in an ambulance or by a doctor in the emergency department. One way to do that is to enroll in a program such as that offered by the firm Medical Alert, which is a nonprofit that sells all kinds of bracelets and pendants and laminated ID cards that you can put in your wallet. Another one is to consider enrolling in the Parkinson's Foundation program to obtain a person with Parkinson's identification card. That's important if somebody goes through your wallet, or if you're unable to speak for yourself, you can show them the card, or the person who accompanies you should be given the card. Third, and probably more importantly, in today's high technology consumer population, consider using the medical applications that are on your cellular phone to make sure that your vital information is available. Let's talk about the letter from your Parkinson's disease physician. The letter should be on the physician's letterhead and should be signed. The original letter in this particular case is something you should keep. You should have copies of it with you, and a copy should be in the possession of anyone who accompanies you. The letter needs to include the listed items as a minimum. They are a specific description of your symptoms and how these affect you. A list of the side effects that are caused by your medications. That's important so the EMTs and the doctors understand that what they're observing is possibly a side effect of the medication that you're taking. An explanation of the criticality of the timing of your medication and meals. This is a very important point that I cannot stress enough. The majority of EMTs and emergency room physicians and nurses are unaware of the importance of understanding the criticality, meaning that you get your medications on time and that the proper time intervals are observed between your consumption of protein and the medications that are in your treatment. By placing this in the doctor's letter, there is a greater probability that this will get the attention of the medical people who are involved in handling your admission. A list of medications and supplements and foods that are to be avoided because of adverse consequences to you, given all of your medical conditions. By having this come from the doctor, again, there's an increased probability that the people who are treating you will pay attention to this as being important as they plan your treatment. And last but not least is the potential for your need for screening for swallowing change to maintain your medication routine and minimize the risk of aspiration of food. Let's talk about medical history. What goes in your medical history? The first thing in your medical history, and this is a big part of the documents that you should be preparing to carry with you. And by the way, you should carry 3 copies. And as this presentation progresses, you'll see why 3 copies are important. The first is an alphabetical list of all of your conditions like hypertension, Parkinson's disease, diabetes type 1 or type 2, or that you have a food sensitivity, such as celiac disease, or you're lactose intolerant. The medical history should include the name of each condition, an indication of whether this condition is currently active or if it's inactive. Let me explain. Prior conditions are important. Your medical history includes not just what's affecting you now, but what has affected you in the past, because some things can show up again, and some things that you've had in the past can interfere or cause new conditions. If it's inactive, was surgery required to resolve the problem? If you know the date of onset or the date of diagnosis, that should be included. If you don't know, and you do know the year, provide the year. Otherwise, indicate an estimated year and put EST next to that year so that the person reading the history knows that's an estimate. And this is very important. Include the name of the physician that treated you or is treating you for the condition and the phone number for the office of that physician. The next item that has to be in your medical history is a chronological listing of surgeries and hospitalization. Include the dates if known, if not the year. If you have to estimate the year, please remember to put the letters EST next to the year so they know it's estimated. Identify the medical condition that required your hospitalization and if a surgery was performed. Identify whether this was an inpatient or outpatient visit to the hospital. If it was an inpatient visit, why did you go? Was it a medical hospitalization, such as for pneumonia or for the flu? Or was it a surgical hospitalization because, for example, you needed to have your appendix or your gallbladder removed? Identify whether or not it was planned or it was an emergent situation. Identify, if you know it, the name of the hospital or at least the city in which the hospitalization occurred. And finally, the doctor who treated you or who performed the surgery, provide their name. If you know it, I would suggest providing their phone number. Another part of your medical history is copies of your most recent reports from blood tests, diagnostic imaging, such as an MRI, a CAT scan, an ultrasound, a mammogram, or a DEXA scan, the report from an electrocardiogram or the actual tracing if you have it, the report from a cardiac echo study, or the report from a cardiac stress test. If the hospitalization or these tests were performed in the same hospital to which you are being admitted or to which you were taken by the ambulance, they will probably have access to these, but you save time by not having to make them go to a computer and look things up and having a copy with you. Let's talk about the list of implanted medical devices. Most people don't realize that it's important for you to communicate implanted medical devices to anybody who is treating you in an ambulance or in a hospital. The kinds of devices that are critical to know about are implanted pacemakers, implanted defibrillators, DBS, deep brain stimulation devices. After cataract surgery, they frequently implant what they call intraocular lenses. This is important because when somebody's looking at your eyes will look like there is a problem if they don't know you have an intraocular implant. If you are wearing an insulin pump, if you have a real-time glucose monitoring device, those are the ones that actually implant little probes. They sit on your skin and are generally worn a month at a time. Whether or not you have a catheter, whether or not you have a penile implant, whether or not you have artificial joints, or whether or not you had repairs made to any of your bones that required the implantation of rods, plates, or screws. In most cases, implanted medical devices are required by the FDA to be documented on a card that is to be given to you at the time of the implant. And you are always suggested to have these with you because they contain specific information about the device, the serial number, the dates of implantation, the dimensions and size. So if you have them, please carry them. Some people include photocopies in their medical records. Some people carry them in their wallets. One point that is not an implanted medical device that I should mention is if you have sleep apnea and you require the use of a CPAP machine, you should check in advance if this is a planned hospital visit, whether or not you should bring your own or whether or not the hospital will provide one for you. Medications and supplements. Both medications that are prescriptions and supplements such as vitamins have an impact on your body. And knowing all of the things that you take is critical to anyone who's providing you treatment. You should start with an alphabetical list of each medication that you're prescribed, prescription medications. The name, the dosage taken, how you take it, whether it's oral, an injection, or an infusion, the name and phone number of the physician that prescribed it, the medical condition for which the medication was prescribed. And this last item is important, especially if you're going in for surgery or some kind of treatment. The date and time that you last took the medication, and you should add this to the printed list that you are taken on admission. An alphabetical listing of each non-prescription supplement that you're taking. That's all of your vitamins, for example. You should give the name, the dose you take, how you take it, who the physician was, and phone number that recommended that you take it, the medical condition, which is why you are taking it, and the date and time of the last administration of this medication. Again, the date and time that you last took something is important if you're going to have anesthesia or if there is another medication that's not on your list that the hospital may choose to give you. They need to know when you last took a medication that can interfere with what they may treat you with. A chronological list. This is important. You need to make a chronology that tells you when you took each medication. In other words, you make a standard diary that says, at this time, you eat this. At this time, you take this medication. At this time, you have this meal. At this time, you take this medication. Making this chronology is very important, because it shows the physicians that will treat you when you had your medications, when you had food, and they can examine whether or not there is a potential interaction with your existing medications or anything they may choose to give you in the hospital. Now, the critical documents that I mentioned earlier are your durable power of attorney, your healthcare proxy designation, who has your healthcare proxy, an information release for access to your HIPAA protected information, and your medical order for life-sustaining treatment. That's an important one. You always have to provide that on a hospital admission or an ER visit. It tells the doctors what you want them to do and what you don't want them to do. The link that is here will also be in the PDF that will be distributed, so don't waste time trying to scribble it down. If you go by ambulance, tell the paramedics you have Parkinson's disease. Give the paramedics one of the 3 copies I told you to have of the documents that you're preparing. Tell the paramedics you may experience bradykinesia or dyskinesia while en route. If they don't know this, they may strap you in too tightly, and you may break an arm or a leg if you start dyskinesia while you're en route to the hospital. Tell the paramedic when your next medication will be needed, okay, and when your next meal will be needed, so that they can highlight this when they transfer you to the emergency department. When you arrive at the hospital, either in the emergency department or in the admissions office, please identify that you are a person with Parkinson's disease right away. Please request that they verify that your electronic health record, if you have one in this hospital, has already been flagged that you have Parkinson's disease, and if it hasn't been flagged, tell them to turn on the flag. Provide a full copy of all of the documents that you've brought with you. Be sure to point out that there is a letter from the physician that treats you from Parkinson's disease, and make sure that they read it. Request that they notify the doctor who treats you for Parkinson's disease that you're in the emergency department and whether or not you are likely to be admitted. Again, repeat the time of your next medication. Make sure that's on their mind so that they know if you need your Parkinson's medication while you're in the ED, they can get the pharmacy to send it over right away. If you're coming up on a critical meal time, make sure they know that so they can reach out to food services and the dietitian to make sure that that's going to be taken care of. And again, advise them that you can experience bradykinesia or dyskinesia at any time, because it's important if you go into bradykinesia that they know that that's why all of a sudden you've stopped moving and they don't think that it's another medical condition. Request that they notify the dietitian and food services if you're on a low protein diet or one where proteins are redistributed according to a plan from your doctor, because if they don't know about this, it's possible that there will be adverse consequences. Request they notify the dietitian and food services that there are foods that are contraindicated given any of your medications or given any of your medical conditions. Normally, medical conditions that are in your electronic health record will in fact be flagged to the dietitian and to food services. However, that flagging doesn't occur often until after the admissions process has occurred. And if there is going to be something you're going to need in terms of a meal while you're in the ED, they need to be aware of that in food services. Now, presuming that the admissions office admitted you to the hospital or the emergency room doctors admitted to the hospital, you're going to be sent to your room. And here's where you have to strongly start advocating. Hospitals never have the same nurse treating you during your stay. Obviously, there are shifts. Even within a shift, nurses trade off. And nursing schedules are such that your daytime nurse one day may not be your daytime nurse the next day. And that goes for the other shifts as well. So the first time you meet a nurse in your room, advise them that you have Parkinson's disease. Take another one of the copies of the documents that you've been sharing during your transit, when you were in the ED, or when you were in the admissions department, and give it to your nurse. and specifically request that they share that document with the charge nurse for the floor, requesting that it be made available to every nurse or nurse's aide who is going to be providing service to you. Advocate for yourself by discussing your concerns about the critical timing of meals and medications. Find out if the hospital has a specific protocol for Parkinson's disease patients. You can sometimes make that inquiry at the time you are scheduling your visit. This is important. Hospitals typically have medication and meal schedules that are fixed and pretty rigid. Sometimes hospitals' medication schedules can call for you to get your medications plus or minus an hour. That's an hour before or an hour after their normally scheduled time. That's totally unacceptable for persons with Parkinson's. As you are well aware, if there is a delay of more than 15 minutes, being 15 minutes early or a delay 15 minutes late, it can have a significant effect on your Parkinson's condition. The same thing goes with meals. Make the nurse aware of the critical timing for your meals and that there may or may not be protein restrictions in your doctor's letter. Make sure they know that the papers you give them includes a letter from your physician who treats you from Parkinson's disease. And also point out if there are any medications or food that is contraindicated by your specific medical conditions or medications. Tell them to be sure that the dietitian and food services have been made aware of these. This process, when you reach your room, is very important because it involves you making your first interaction with the floor staff. And it's important that the charge nurse be aware that on that floor and in that unit for which they are responsible, there is a person with Parkinson's disease. Here's an important point that you also need to make known to your nurse, both when you arrive on the floor and each time that you meet the next nurse who's going to be treating you as they change shifts. You need to advocate for regular, safe, physical movement at least 3 times a day. That means they need to know that you need to get regular exercise at least 3 times a day, unless your doctor has told you otherwise, and I mean your Parkinson's doctor, because they need to arrange to have someone available for you to have that exercise. If for some reason they don't come to you because it's exercise time, you need to press the call button and tell them you need them to send someone with you to accompany you as you walk around the unit or do whatever exercises your physician has told you to do. Again, each time a new nurse comes to you, you have to go through the same process again. Eventually, the nurse will tell you they've been made aware, and it won't be necessary for you to go through the whole list, but at least the first time a new nurse or a new nurse's aide shows up in your room, you have to go through the process. At this point in time, I'm going to stop sharing the slideshow, and I'm going to open the floor for questions.
People can feel to unmute if you want. I know we have questions in the chat.
All right, if we have questions in the chat, then I'm going to ask either Nancy or Angela or both of you to make the questions known to me. I'm also going to suggest that each of you can turn your videos on if you want. It's nice for me to be able to see the people who are attending in order that I can appreciate their needs. What's the first question?
Okay. Oops. Yeah. Is the chronological record of medications and meals made in advance or in real time?
No, the chronological record of medications and meals is something you should make in advance because this is the template that you are current and the documentation of what you're currently doing at home, and you need to be as close to that when you're in the hospital. It's a way of documenting the relationship between medications and meals, and it shows the timing that each medication has been scheduled for administration by your physician. Next question.
Do you have resources about the protein interactions? I This person had never heard of this until yesterday. I think actually that's probably not an uncommon question. Some years ago, there was a lot of thing about the low protein diet. I don't personally find I hear about it as much as I did when it was kind of newer in the pipeline.
Um, the reason that we're hesitant to provide um, information about that is unique and specific to each person with Parkinson's. And this is a discussion you absolutely have to have with the physician who is treating you for Parkinson's disease. If they haven't brought this up yet, then question them about it, because different people have different requirements in terms of whether or not protein is given at different times of the day relative to when the doctor has prescribed the medication, whether or not you're allowed multiple protein meals, or whether or not protein has to be distributed throughout the day because of the level of medications that you're taking. Our presentation today was not meant as medical advice. It was designed to provide you with information that you should know about in order to advocate for yourself and in order to have constructive conversations with the physician treating you for Parkinson's disease, or with ambulance attendants, or with emergency room staff, or with staff on your floor. Next,
Anybody else have anything to
those
add
the
to
only,
David's comment?
Angela?
There's one more question.
Oh, yeah, go ahead. I
Jen.
wanted to see if we were finished with this question. Anybody?
Oh, go ahead, Nancy.
Yeah. If there are no other comments. Yeah, the last question is, I'm an adult child of a person with Parkinson's who lives 90 minutes away. How can I help implement all this talking to providers if I'm not there all the time? Patients can't necessarily do it. You're absolutely correct. Anybody want to take on that
I
question?
will answer the question first. Um, One of the things that you have to do is appoint somebody as your healthcare proxy and to provide them with the release for access to your HIPAA information. Another thing that we brought up was the need to have a medical device or medical identification, and also to potentially use the app in your phone. The reason for doing that is each of those processes includes a section for who is to be notified if you are taken to the hospital by ambulance. So if you're taken to the hospital by ambulance, someone will know who is to be notified that you're in the hospital or that an ambulance is coming. The preparation of the documents is something you can do with your family member who has Parkinson's disease, and make sure that they have 3 copies of those at their home. There is a thing called the Vial of Life, which is an adhesive folder which can be put on a refrigerator or someplace prominent in the home, in which you would normally deposit this kind of information. Or you could deposit something as simple as a statement telling the ambulance attendant where the documents can be found in your home so that the attendant can take them. Normally, an ambulance attendant will notice if you are wearing a medical alert bracelet or a medical alert necklace. Some people also use the medical alerts that can be fastened to their shoes. If they see that, if depending on which kind of device it is, they can either scan the QR code or they phone the toll-free number. They will get the information that they need from them in that manner. You can also call the hospital where you normally obtain your medical service. And usually the best way to do this is through your doctor who is an attending at that hospital if they are. And you can make sure your medical record in the hospital is flagged with a person to be notified name and phone number so that the minute you're in the hospital, they will know to call that person. If there's anyone else who is a care partner who's on this call and wishes to offer an alternative suggestion, please raise your hand so that you can be recognized. Okay.
Or just unmute yourself. Okay, another question in the chat. What if the
Wait a
hospital?
minute. Virginia has raised her hand.
Oh, great.
Virginia, you need to unmute yourself. I can't hear you. Virginia, you're muted. I cannot hear you.
Yeah, she knows. She's
Oh,
working on it. There you go.
I couldn't figure out what to miss. So this might be too far afield, but do you know about a program called Alula that Jason and Bridget Eversole have set up in Charlottesville? And it's for what they do is it's for whole families and friends of the person with Parkinson's to have access to all of their records in one place at the home. So whenever a new person comes in, they'll have all the records there. And it's and for people who are for family or whoever who don't live in where they live, who live away, they can also have access to all of this. So it's made available to everybody who might be part of the care team for the person. And I don't know if you know anything about that, but he started it last year, and it's a wonderful resource.
There are several such programs that organizations, individual organizations throughout the country have set up. They're not all necessarily known to all of the responding fire and EMTs. The best way, to be honest with you, is to make sure the information is at least with one of the nationally recognized organizations. In terms of sharing things with family or friends, that's something that we always encourage. But in terms of the programs that are done by individual organizations, I can't say anything about the extent to which they follow HIPAA practices. And PSN has to be very careful that we don't advocate for something that might violate your HIPAA protections.
Right.
So that's up to a patient to be able to examine. We know the national programs are all 100% HIPAA compliant.
Thank you.
Thanks, Ginny.
Thanks for bringing it up, Bridget.
Yes, thank you. Another question. What if the hospital that you've been taken to doesn't have visitation rights? Oh, I guess if you're of your doctor.
If
not
your
sure.
physician does not have privileges at the hospital to which you are taken, they still, at your request, have an obligation to contact the physician and let them know. Typically, physicians know other physicians who have privileges. If you're going to be seen, and in most cases today, you're going to be seen by what's known as a hospitalist, which is usually an internist who is on the staff of the hospital and who sees patients who are admitted to the hospital. These hospitalists will typically have access to specialists that are needed to support patients in the hospital. If your physician is not one of the specialists they can call, then you need to make sure they know that if they have neurologists that they can get for you, if possible, to get a movement disorder neurologist. But most neurologists are medically competent to know what their limitations are. And if they call a general neurologist who is not sufficiently familiar with treating Parkinson's disease, they're usually smart enough to find one of their colleagues who is. But it does happen. And another thing that can happen is that on one-off situations, if a hospital cannot provide the proper medical resources, your physician can ask for emergency privileges, and those can usually be granted fairly quickly because the hospital does not want to be in a position where they are incapable of providing proper medical treatment to a patient. Unfortunately, it becomes the responsibility of the patient or the person who accompanies the patient, their family member or whatever, to advocate the patient for the patient's needs if that situation exists.
One more question at the moment. Can you talk more about the Vial of Life and where I can get more info on it?
I don't have the link right now in front of me, but if you do Google the expression vial of life, it will tell you, it will take you to the organization that advocates for it, and it will tell you where you can get it. Depending upon the volume of pages in the documentation you have, it's not going to fit in the Vial of Life folder, which was originally designed just to have your medication listing and your listing of medical conditions. Many people have gone to the store and they have either purchased a red box folder or a red 3-ring binder, and they label it medical records or critical medical records, and they keep that in the house in a prominent position, prominent location that an EMT would see, or you could tell them that that's where it is. If you call for an ambulance and you're unconscious, there are a whole lot of other problems that they're going to have, including the need to break your door down to get in.
So
And in some areas, excuse me, Mike, the fire departments, I once got a supply from our local fire department to share with some people. So I think it varies from area to area. Angela has put the link in the
Oh,
chat.
and another thing that I will point out is that a lot of the fire departments are now instituting the flagging of the homes physically with decals on the entrance doors that tells them that there is a disabled individual in the home. And a lot of fire departments allow you to make what they call a location of interest entry for your address, where they will indicate that the people or the person living at that location has Parkinson's disease and where they can find the folder. If you have a lockbox on your by your door in which a key to your house has been placed, if you live alone, the fire department will place the information and combination for that lockbox in their computer system, and that information is shared with the ambulance when it in fact is dispatched to your location. I always recommend doing that. I mean, the most expensive thing that you can do, and some people do it and will be doing it, is to have what they call a Knox box installed. Knox box is a product that fire departments nationwide typically make use of. And what it is it's a lock box that's fairly rigid, that is placed, and it's also reflective in a location that the fire department tells you to put it. You put the house key in it with them, and they have the key to open all of the Knox boxes in their county. Police don't have it, but the fire departments and the EMTs do. So if they come to your house and there's a Knox box, they're going to open it and they're going to know right away that there's computer information on file for you. but they're like $350 a piece, plus anywhere up to $500 to install.
Another question, excuse me. You mentioned EMT or physicians not attributing Parkinson's symptoms, sorry, to another medical issue. Can you speak to the opposite? We encounter providers who insist nothing else is wrong because it's just Parkinson's.
That's a real problem today, not as much with the EMTs as it is, or my experience has been that it's not as much with the EMTs as it is with physicians, both physicians in private practice and physicians in the emergency department. I don't know how to tell you to answer that other than to re-emphasize in the physician's letter the issue of symptoms that your Parkinson's disease and or other conditions can cause, or that your medications for Parkinson's disease or other medical conditions can cause, so that not everything is attributed to just Parkinson's disease. It's unfortunately all too easy for people to take that as an out. And the only thing you can do is to advocate for yourself or have the person that accompanies you advocate for you.
David, I have a question for you.
Yes.
I've heard stories where people have gone in the hospital and had to relinquish their medicines to the hospital, and rather than keep it to themselves. How is there any way to avoid that?
No, unfortunately, Carl, the Joint Commission, which is the regulating body, accreditation from which hospitals must have, or they risk revocation of their licenses to be as a hospital. The Joint Commission requires, as do most hospital lawyers, that all medications be in the custody and control of the hospital. If when you are admitted, they should be doing what's called a medication reconciliation, where they go through the list of medications that you take at home, and they look at whether or not the doctor who admitted you has discontinued some medications and added other medications, and they identify medications that they don't have in the hospital. They may offer an alternative medication. If somebody does that with your Parkinson's medication, that they intend to give you an alternative medication, you need to make sure that somebody has called your Parkinson's physician and cleared that alternative substitution with your Parkinson's physician. I know when I have been admitted to the hospital, and other people as well, where a hospital doesn't have your medication, they may authorize you to bring your medication in. They will typically send it to the hospital pharmacy for verification. The pharmacy will tag it, and it will be in the custody and care of the nurses on the floor. You will be given the medication from your supply, but patients are not allowed to self-medicate in their rooms. Another thing that I didn't address, but it may be that some people with Parkinson's disease also have type 2 diabetes or type 1 diabetes. Anybody taking oral medication for diabetes, like metformin, Tradjenta, or any of those other things, most hospitals now are discontinuing the use of oral medication for admitted patients, and they are administering insulin to patients with diabetes and not the oral medications. And this is done so they can more tightly control the glucose levels of the patients, because in addition to administering insulin, they are testing you multiple times a day and adjusting your insulin dose according to what your most recent test has. That's something that they don't explain to you, and you find out about it when you get in the room and you all of a sudden realize you're not getting your metformin or your Tradjenta or whatever, and that they're showing up with insulin shots for you.
Carol, did you have a question you wanted to ask?
Well, I was just going to comment because I've had that experience. The last time I was admitted to the hospital was through the ambulance because I had passed out. And when I got there, I was able to explain what medications I was on, and they did not carry the slow release version of my carbidopa levodopa. And when I have the immediate release stuff, I get sick to my stomach and have all kinds of bad reactions to that. So they agreed that my friend could go home to my house and get my medication. She brought it back. They then took it away from me to the pharmacy. I gave them my schedule, 6 o'clock, 11 o'clock, 3 o'clock, 8 o'clock, and they took the medications. I did get one that evening, and I asked the nurse about getting my 6 o'clock meds, and they said, no, we don't do meds before 9 o'clock. So I get the 9 o'clock dose, and then they finally get onto my schedule and try to give me another dose at 11. It was very, very frustrating. And I had unofficial advice from someone else that I might want to keep a second copy of my medications with me, that they did not take away from me, that I didn't share with them so that I could get my dose when I need it.
That's the reason for the 3 copies. You give one to the ambulance attendant, one to either the ED or the admissions office, and one to the nurse. Yeah, you could make a 4th copy and have one in your room if you want. But the reason that it's important to talk to the nurse, the first nurse that you see when you get there, is to make sure they have on the floor your medication schedule and that they know the importance, which is in the doctor's letter, for your medications to be given at these precise times.
Yeah, it was just a very frustrating experience.
It's extraordinarily frustrating. It's happened to me.
My physician is in a different town. My Parkinson's doctor's in a different community, and she was on vacation at the time, but her nurse got a hold of her for me while I was in there, and she didn't have much more luck than I did. She at one point they couldn't even verify that I was in the hospital for her. She told me, the next time you have to go in, if at all possible, you get yourself to this alternative hospital where she has admits, because she didn't think.
Yeah, that is in fact a problem. Now, one thing you can do in advance to prepare for this, and I did not include it in the presentation because it is something that is very geographic specific. You can call the emergency 911 center, and you can ask to talk to the supervisor of fire or EMT operations and ask the question, what is the hospital to which you would be taken if an ambulance is called to your home? And if it's not the one you want, ask whether or not there's any flexibility. Part of the problem is municipally funded ambulances, even if they bill you, by the way, they're still called municipal ambulance services as opposed to private ambulance services, are very often bound by county regulation as to where they are required to take a patient, unless that hospital is on reroute or they're closed, to ambulances, in which case all bets are off. But you can find out in advance if they have any options to take you to that hospital.
Is
And
it
if they do, Carol, let me finish if I may. And if
Sorry.
they don't, what you want to do is you want to alert your physician to that so that your physician can either verify they have privileges or find out what they can do to make sure that you get an electronic health record set up in advance that has the Parkinson related information in it. I can tell you that most of the modern electronic health records that are used today, like Epic or Cerner or Oracle, have what they call patient profile pages where critical information about a patient is listed. And that's separate from the actual medication listing and the general medical conditions listing, but it's where they might put something that flags them as a diabetic, flags that they have narcolepsy, flags that they have sleep apnea, flags that they have Parkinson's disease, flags that they have mental health issues. And that shows up anytime somebody logs in to the medical record and selects you as the patient. So
Well,
if that's available in the hospital where they're going to take you, you need to try and get your doctor to make sure that gets set up for you.
well, I just basically need to try to not go to the local hospital because they do not share their information. My Parkinson's doctor has a lot of trouble getting information from their system, and they're in a world of hurt. They're bankrupt right now, and it's a mess.
Yeah, no, the problem getting about sharing information from the system is a technical problem. But if you have signed the HIPAA release form and identified your treating physician, they're required by law to share information with that physician.
Okay, I'll look for that. Okay, thank you.
One more question in the chat. Do you think it's smart to have your movement disorder specialist add the medications you should not get in the hospital, such as adding it to your allergy list?
Well, adding it to the allergy list is not necessarily the most effective way. What I did put in the doctor's letter is they should list medications that you should not get because of either your medical conditions or the medications that you take, such as the Parkinson's medications. And I did, and it is something that you need to share on admission and in the ED or in the admissions office. And when you go to the floor, it's on the list of things that you have to share and reinforce. Putting it in the allergies list is not necessarily appropriate because the allergies list is looked at only in terms of if you start to show signs of anaphylactic shock. Okay. The allergies list is not a place to put contraindicated medications if they don't cause a medical reaction.
Does that answer your question? Okay, great. Other questions?
Now, I will add a caveat.
Yeah.
Unless it's the policy of that hospital to want it to be in the allergies list. Okay. It's better to be in the doctor's letter, and it's better to be in the list of medications that you provide that you are contraindicated for you. That's why anytime they come in with a medication, ask what they're giving you and what the dosage is. That applies to any patient in a hospital for any reason, whether you're a person with Parkinson's or not.
Yeah, Mike.
My doctor, the only reason he did that is he said that. So I had mentioned that I would most likely, hopefully, have the hospital safety guide with me or something like that, along with a letter. But in the event that something happened when I was out and didn't have those things with me, he thought that would be a backup to, for instance, if I was in a car accident and I obviously wasn't expecting to have to go to the ER and didn't have any of those things with me, that was a good way to have backup in the event that I got in there and
So is he talking about you putting it in your medical record through the portal?
No, he added it in. He added it into my Epic record.
All right, into your Epic record. That's fine, but
more as a backup, not as a first line thing.
Yeah, no, there's another place in Epic if the hospital has it implemented where they should be putting contraindicated medications. But it certainly, if he puts it in allergies, it improves the likelihood that somebody may see it. But you can also put that as a contraindicated medication in your file with MedicAlert. So you get it from two places.
Other questions?
I don't have a question, Nancy, but I just want to thank David for doing all the research to pull this together and really that it sparked me to go back and update some stuff, because you just never know when something like this is going to happen. And if the care partner is not available, or for some reason the person with Parkinson's is unable to speak, I think it's really important that we take little small bites and try to get to the point where we have all this information in one place.
Okay, let me stop.